Good afternoon, everyone, and welcome to our webinar today. I'm Tom Glinsky, Chief Inspector with the Board of Pharmacy. Today we're doing a webinar dedicated to pharmacy technician issues. So we'll get started. With me today, I have Natalie Foster. She's our inspector from the southwest part of the state. So Natalie, thanks for joining me today.
Pleasure to be here. Good afternoon, everyone.
So if you haven't been on one of our webinars before, you're in a listen-only mode. If you have any trouble connecting, if you're on a browser or on a computer, you can go and change the setting and go off a computer audio and dial in, and it gives you the instructions on your toolbar there. This has been approved for 1 hour of pharmacy CE. Computer sharing is not allowed. You must be logged in under your own username to get credit. We do not give credit for those only listening via phone and not logged in. At the end of the webinar, I will give further instructions on how to get CE. And just a reminder that we do not submit CE to the CPE monitor, so make sure you save your certificates. And then since we have a lot of technicians on today, just a reminder, this is not an ACPE accredited program. If you need CE, if you're certified and you need CE for your certification, you need to ask your certification provider, that would be TCPB or NHA, if they will accept the board approved program, since it's not ACP approved. I do not know the answer to that. And then for pharmacists, even though this is dedicated to technicians today, you still can use this for renewal of your pharmacist license. And again, if you have out-of-state licenses, do not assume another state board will accept this. You need to check with them first. If you like handouts today, there's 2 places to get that. You can go to the board's website. If you go to the upcoming events page, there's a link there that will take you to that. It's not working as it normally does, and when you click the webinar handouts link, it usually gives you a list of all past ones. That's not working today, but it will take you directly to today's handouts. If you're connected on a mobile device, you can the other place is through the GoToWebinar program. If you're on a web browser, on your toolbar down at the bottom, you'll see a tab called Handouts. You can get it there. If you're on a mobile app, you'll see 3 dots somewhere on your screen. You click that and then click View Materials, and you'll see the PDF of the handouts. We are recording today's webinar, and we post those on our website with all previous ones if you want to watch it later. We will, if time permitting, we will take some questions today related to the topic of today. If you'd like to ask a question and send it to us, if you're on the web browser, go to your toolbar and you enter it and then hit send. If you're on a mobile app, this varies if you're on a phone or if you're on an iPad. Somewhere on your screen will be a box with a question mark in it. If you click that, you will then get the question window where you can type in your question and submit it. So we're going to go ahead and get started. I have today's program broken down into different topics. I'm going to talk first a little bit about MoPro. That's our new licensing system, on some of the things you can do on that. We'll talk about technician activities, some of the new opportunities that have come available in the last few years for technicians. Talk about some of the responsibilities if you're a technician, what your responsibilities are. We'll talk about some compliance issues related to technicians, and then I'll talk about, briefly go over some of the resources we have out there for technicians. And then, as I said, time permitting, we'll take some questions and answer them. So first, we'll talk about MoPro. That went live in January of this year. Most technicians would have renewed, and so they would have had to create an account in order to renew earlier this spring. If you haven't created, it could be some people technicians who haven't created an account yet because they submitted a paper application and after renewal period. They may not have a login yet. So if you go to this website here, it's the main website for MoPro. You can log in or you can register there if you don't have one. Once you're logged in, you'll see a screen like this, and there'll be a My Licenses link on the right. If you click that, that will take you to a list of your licenses. So technicians would just have one there. If you click that, then you'll go to a page that has different options on the right side. One of them is it's the top one says amend. So if that you can amend, and that's making changes to your license. If you click that, you can now submit a name change, employment change, or a change of address online and do it automatically there through this link here. The other thing for licensees, MoPro now lets you download a copy of your certificate should you misplace yours, it doesn't come in the mail, whatever, you need another copy, you can download a copy from here. There is a difference between this one and the two above it that says request for duplicate license. Don't click that because I believe that one will charge you for it. Do the download a copy and you'll be able to get a copy there if you need another copy of your certificate. And then for technicians who hold licenses in other states, should you be disciplined in another state, you're required to report that to us. There is a link here that you can do that on the MoPro app here. As of August 4th, the board is no longer accepting paper technician applications. We're still getting some coming in. We will be rejecting those. All applicants have to go through MoPro now in order to that. So this is kind of a message for the pharmacist in charge or the pharmacist on the call. If you hire someone, a new technician, do not submit a paper application. They need to go online. If you have any paper applications, please destroy them. We're still getting copies of some of them in. It's no longer on our website, but we know people do have some copies of them. Fingerprinting is still a requirement. It's not part of the MoPro process, application process. It's a separate process. It's still required. I understand from the desk that processes these are still getting applications with no fingerprints associated with them. Ident-Go is the state's fingerprinting vendor. There's instructions about fingerprinting on the MoPro app, but they're also on the board's website. If you go under applications, if you go to technicians and their application, you click that, you won't get the application but you will get all the instructions about how to get fingerprinted. So next we're going to talk about some technician activities. Earlier this year, the board promulgated a rule. It's in effect now. It's called Authorized Pharmacy Technician Duties. And it says that a technician can assist in the practice of pharmacy, assist the pharmacist. But it does list some things that are prohibited, and these are the bullets directly from that rule. Any activity that requires professional judgment of a pharmacist, patient counseling, a prospective DUR, advising on any kind of therapeutic duplication, drug diseases, interactions, allergies, stuff like that, making recommendations to patients on even over-the-counter products would be prohibited. Prohibits a technician from doing any kind of final verification of a filled prescription, except we do have a rule that does allow, I'll talk a little bit more about this later, about technology assisted verification. That is allowed, a technician can do that. And then it just says any other activity required to be performed by a pharmacist or prohibited by other board rule. So I listed some of those other things here. So these are some that are prohibited by rule. A technician cannot compound, prepare, dispense, or administer without a pharmacist physically present. There are exceptions for certain classes, F, L, Q, and R. A technician cannot transfer a controlled substance prescription to another pharmacy. They cannot do data entry verification. A pharmacist always needs to verify the data entry. And a technician could not go to a long-term care facility and apply a prescription label, like if there was a label change. Only a pharmacist can do that. And then just an example of something that requires a professional judgment, overriding a DUR message independently. Technicians are not allowed to do that. So these are just some examples of some of the other things. It's not an inclusive list, but just some that comes to mind of other prohibited activities. In this rule, there's a new allowance for technicians when it comes to, it's in the bullet that talks about counseling. It now says that a technician may read directions or other informations exactly as printed on the prescription label or container or other pharmacist approved written communication. So again, but this is only if the authorizing, it's authorized by the delegating pharmacist, so the pharmacist on duty, and the pharmacy has to have a written policy and procedure detailing what that activity is and what you're able to read. So if the pharmacy complies with all that, a technician, if asked, how do I take this medicine, could read the directions directly off the bottle to the patient. If the patient comes back, do I need to take it with food? That's not on the bottle anywhere, then they would have to refer that to a pharmacist. Another example would maybe be if a technician's giving an immunization and the pharmacist is prepared a standard statement to read about adverse reactions or something like that, they could read that to them. But again, this has to be approved by the pharmacist who's on duty that day. Has to allow this, and the pharmacy has to have a policy and procedure on it. And then the new rule also says technicians can give out information about vaccines to a patient, what's available, their eligibility, or maybe their past vaccination dates. But again, this has to be approved, by the pharmacist that's on duty. If they will allow you to do that. If a technician's work always has to be verified by a pharmacist, these are some examples. Filled prescriptions, except there are allowances for technology-assisted verification in certain classes, again, F, L, Q, and R. The pharmacist must check the contents and the effects label. If a technician reconstitutes an antibiotic suspension, a pharmacist must always double check it after they've done that. And then any kind of data entry, prescription data entry into the computer system must be checked by a pharmacist, except there are some exceptions for class F, Q, and L. We get questions about technician certification. Certification is not the same thing as your board license. It's a totally different entity. Certification is not required in order to get a Board of Pharmacy license. However, certification is required for certain activities if you're going to perform them. Technology-assisted verification, administering vaccines or drugs. If you're working without a pharmacist at a Class Q charitable pharmacy, or if you're the technician running a Class R remote dispensing site pharmacy, those all four things all require the technician to be certified in order to do that. And the certification must be current. Certifications expire, you must renew those, and they must be current. And then it has to be by a program accredited by the National Commission of Certifying Agencies. Currently, there's PTCB and then NHA, which used to be called Accept, are the two that are currently out there. Again, don't call the board office if you have questions about certification. We cannot answer those for you. You need to call whoever the certifying body was that certified you, or if you have interest in becoming certified, you'd need to check with them. I will say there are some employers who are requiring certification of technicians. Again, that's not a board requirement. It's only required by the board based on what activities you do. Next, I want to talk about some of the opportunities that have come up for technicians in the last few years. The first one is technicians being able to immunize or administer a drug. This is the one we see the most technicians doing. This came out of the pandemic when it was allowed. During the pandemic, the board put that into rule to make it permanent. We have a rule for 6.040 is if you're administering by prescription order. 6.050 is if you're doing it under the pharmacist's own authority or if they're using a protocol. Technology assisted prescription verification, that's a separate rule. It allows a technician to check the work of another technician if they're using technology such as barcode scanning, but it can only be used on certain products. One is unit of use from the manufacturer or product that has already been checked by a pharmacist. So they like a pre-filled bubble card that had been checked by a pharmacist. If that had barcode scanning and your system can confirm via that technology that that's the label was applied to the correct package and that. So the rule, it has specific requirements. I'm not aware right now of any pharmacy doing this, but it is out there. If a pharmacist wanted to do that, and that does allow a technician to check the work of another technician, but again, very specific on what it can be used for. A few years ago, we revised the supervision rules, and we now allow for remote supervision. So technicians can work remotely and still assist in the practice of pharmacy for certain things. We have a rule 2.710 about that, and then 6.055 is the non-dispensing rule. That says what a technician could do outside of a pharmacy. They can't be involved in dispensing, but they can do other things. And supervision, it leaves it up to the pharmacist on what type of supervision. Is it just audio that could be done by a cell phone, or is there need to be video? It leaves it up to the pharmacy to decide, what the supervision that's needed for what activity. So we now have, expanded opportunities for technicians working remotely. We also wrote a rule specifically allowing technicians to do data entry remotely. So doing it, you could do it from a residence. And that, again, it's a specific rule, has requirements. The pharmacy would need to comply with all that in order to do that, but it does free up some work from home possibilities for technicians. Class R is a remote dispensing site pharmacy. That is a pharmacy that is completely operated by a technician on site. The pharmacist is remotely doing supervising via technology, audio, and video. And then class Q, that's charitable pharmacy. There's provisions in there to allow technicians to work without a pharmacist present. So more opportunities the last few years to, allow technicians to do more. It helps assist the practice of pharmacy more, help, if we are having shortages of pharmacists, taking some of the possibly work off pharmacists for certain things possibly. So now I'm going to talk about technician responsibilities. If you're licensed with us, you need to keep your renew your license each year. That is May 31st each year. Technicians have a 1-year license. Interns and pharmacists both have a 2-year license, but technicians are still at 1. You are required to keep the board updated on any address changes, employment changes, or name changes. And again, you can now do this by yourself on the MoPro app. And as I mentioned earlier, if you hold a license in another state and you become disciplined in that state, and some examples are, we have one border state that requires technicians to get CE. We've had technicians who hold licenses in both states be disciplined in that state for not complying with that CE requirement. So if you hold a license in another state and are disciplined, you are required to report that to us within 15 days. That can be done on the MoPro app. It can also be done by sending an email to us, will also work. But if you're dually licensed, you do need to be aware of that. You need to respond to board correspondence. That could be on a pending application or a change in an application. Sometimes there'll be inquiries based on that, especially pending applications. If you've submitted one, you have a criminal history, the board may need more information about that. The board does send out communications to technicians, either by letter or by email requesting information sometimes. And then inspectors request request to contact you if they're doing investigations sometimes that they need input from you on, or maybe possibly you are the subject of an investigation. So you need to make sure you respond to any correspondence from the board. You need to be honest with your employer. If you fill out an employment application, you need to be honest, especially when it comes to criminal history or previous Board of Pharmacy discipline. That could be in this state or another state. Employers, if they hold controlled substance registrations, have to know about previous convictions related to drug things, and because they're required to get a waiver in order for an employee with a previous history to work around controlled substances. So you need to be upfront with them. You also need to be upfront with them if should you be charged or get convicted of one since you apply, getting your license with us. For a waiver, it's DEA and BNDD has different requirements. For DEA, it's for any felony drug related conviction. BNDD, it is for both felony and misdemeanor convictions. So, and that doesn't go away. They may issue a waiver, but the employer always, regardless of how long ago the conviction was, the employer needs to request a waiver. And then should you become disciplined by the board on your technician license, you need to report that. Part of our, some of our documents require you to, if you're on like a probation with us, you're required to notify your employers of that discipline. You need to be honest with the board and inspectors, so completing applications, completing your renewals. So every year when you renew, there's certain questions you have to answer. One is related to criminal activity in the last year. Have you been charged or convicted? You need to answer that correctly. Inspections, inspectors will ask technicians questions. We expect to get an honest answer. Inspectors like to go to the people who are actually doing the work and ask them how they do something versus just asking, maybe the pharmacist in charge who they oversee it, but they don't actually do it. So we might go directly to the person who does something. And then also on investigations, there's investigations that we need to reach out to technicians to get input from, whether they're just a witness or maybe they're the subject of the investigation. You have the responsibility to make sure that you do your employer training, what's required. I recommend you do not do a task if you've not been trained on it, and don't be afraid to ask for retraining if needed. It's common that you might have been trained 5 years ago and now asked to do something you haven't done. So, or maybe the procedures have changed. So make sure you ask if you need help. Policies and procedures, pharmacies are required to have them covering lots of topics. You need to know what your pharmacy's procedures are. You need to review them. Again, you may have reviewed them when you were initially hired, but usually policies and procedures change over time. And again, don't be afraid to speak up. If the policy doesn't match what really goes on, you should notify someone. That's not how it's done. Either you're doing it wrong or they haven't updated their policies and procedures. And then also, if you have a suggestion for improvement, pharmacies like to hear how to improve things. If you're the one doing the activity, you might have a better suggestion for them. Do you know what to do in case of the following things? If you encountered an impaired coworker, or if you yourself have a substance abuse problem? We now have a well-being program in the state for pharmacy. It covers pharmacists, interns, and technicians. You can inquire there if you're having trouble with health issues, mental health, substance abuse, things like that, that you can reach out. There's information on the board's website on how to contact our well-being program. It's been up and running now for a few years. You know what to do in case of a robbery in the pharmacy. We don't want people hurt if a robbery is occurring, and most pharmacies have a procedure or instructions on what you should do. Do you know what to do in case you come across, or if you're involved in a HIPAA breach? You were all trained probably on HIPAA at some time. Do you remember what to do if you encounter that? If you encounter drug diversion or theft, do you report that? You should report that to management if you're aware of that. If you're fraudulent prescriptions, if you're doing data entry and you're seeing things that don't look right, you need to report that to your supervisor. Healthcare fraud is another thing. Sometimes it's the employee who uncovers an issue of something going on in the pharmacy. You all do fraud, waste, and abuse training that instructs you what to do in case you do come across fraud. If you or others aren't following the pharmacy's procedures, do you know what to do in that case? Or if someone's violating pharmacy laws and regulations. So if you don't know what to do in these bullets, you should reach out to your employer and ask them, what do I do in case of these things? Don't be complacent. Don't be afraid to report issues. You can always go to the pharmacist on duty, the supervisors or other people of management, the store manager, the district supervisor. You can always report stuff to the board of pharmacies. You can go, if you know your inspector, you can go there. You can always find out who the inspector is on the board's website. We have a table showing by county and then in St. Louis area by zip code who the inspector is. And then you can also reach out just directly to the board office if need be. You need to speak up if you're ever asked to do something that's not correct, like dispensing outdated drugs. If someone tells you go ahead and do it, that is not correct. Create a fraudulent record. Someone asks you to record that you did something that you didn't do. Cover up a dispensing error. Practice unsupervised. There's things that you're not allowed to do. If someone tells you it's okay to do, what do you do in that scenario? And then provide prescriptions to patients when no pharmacist is present. There is exceptions for class F, L, Q, and R, but other than that can't be going on. And sometimes we know technicians are asked to do these things by pharmacists who is, at that time, supervising them, ask them to do things that are not correct. You need to speak up if you witness drug diversion or theft, fellow employees impaired on the job, people violating policies and procedures, issues with drug security, and then unsanitary, unsafe conditions. We do get technicians who report issues about sanitation in the pharmacy and stuff like that to us. It's speak up, report it, start with management and see if they can't get the issues fixed. Then you can speak to the board if needed. You speak up if you witness healthcare fraud. There's different kinds of fraud. There's billing schemes, bogus claims, just outright bogus claims that don't, for people that don't exist or prescriptions that don't exist. Cases where one drug's dispensed but another one's being billed, or maybe the quantity that's dispensed but they're billing for a higher quantity. We have seen fraud related to reversal of claims. This could be a return to stock. We've had this a couple times where pharmacies are not When they return it to stock, they're not reversing the claim when that happens. Nursing home returns, we've seen that before when returns are coming back and being reused, but no one's reversing the claim, the original claim. And then same thing with OD medications. When the patients don't come pick up their ODs, those claims should be reversed. And so the correct amount will be billed to the insurance. Technicians play a role in preventing errors. So, and this is, a vital role you do if you're involved in the dispensing process or data entry process. You're the, very, very, very important role you play. So if in doubt when you're doing data entry or counting and pouring a prescription, make sure you ask. It's best to double check your work. Slow down and stay focused. Keep the cell phone off the counter, and avoid distractions. Follow the pharmacy's policies and procedures. Make sure you're doing that. Remember to offer counseling if you're the one making the sell to the patient. And then you need to report errors per pharmacy policy. Some have specific programs where they need to report the errors too. Make sure those are being reported because you learn from errors. And that's how, we all learn from the errors we make. So that's, it's important that errors do get reported to the pharmacy's program. Next, I'm going to talk about some of the compliance issues we see related to technicians. So a few years ago, we required all employees in the pharmacy to be wearing name badges. We still come across staff, not just technicians, pharmacists too, not wearing name badges. So it's important that the name badges are worn. For technicians, it does need to say technician somewhere on the badge. You cannot just use an abbreviation like CPHT. It needs to have the word technician on it, on somewhere on that badge. If you're a store manager and you sometimes come back into the pharmacy, your badge needs to say technician on it when you're in the pharmacy. It just can't say store manager. All licenses, when we did the badge, we now require all licenses have a photo posted with them. So we see that where not everyone does. The new MoPro system will be for people who submit a photo with their application. It will print it on the certificate now, and it will come on there. People have asked, is that okay to use? And people got their ruler out and said that photo's not 2 by 2. And so the answer is that's okay. If we printed it on there, it doesn't have to be 2 by 2. That's fine. Just make sure if it is printed on there that it is that you can see the person in there, see their face in it on that. Certification, as I talked about, it's not required except for certain activities. We come across technicians who fail to renew their certification. Once it's expired, they should stop those activities such as immunizing. If you don't have a current one, you should not be immunizing. Failure to offer counseling, usually it's technicians who are running the pickup counter. It's their response, it's their role to offer counseling to the patient. We come across lots of times where that's not happening. When we do investigations and we're talking to patients, we do ask them, we offered counseling at the time you were picked up. Some of the times they told us no, they never were offered any counseling. Technicians should not be providing counseling. We find this on inspection sometimes where we hear technicians counseling patients on adverse reactions, side effects, how to take their medicine, making over-the-counter recommendations, stuff like that. Again, we do have the provision that you can read something verbatim, but again, the pharmacy has to have a policy and procedure on that. I mentioned earlier reconstitution. We find when we're in pharmacies, we watch what's going on. We'll see a technician reconstitute something and then go directly sell it to the patient. For those that do preparing bubble cards, this is usually where we see no gloves being worn. If you're handling individual loose tablets and capsules, you need to be wearing gloves when you're doing that. We find times where this is not happening. Depending on the activity, some require an initial and annual competency assessment. And so here's a list of what requires these competency assessments. So immunizing, administering drugs, immunizing requires it. If you're involved in electronic verification, and that is a system where the pharmacist is not physically handling the filled prescription, looking at the contents in the label. A photo has been taken and they are viewing an image of that on their computer screen. And that's usually a technician who's running the camera and the scanning and all that. That technician who's doing that has to go through the competency assessment. I mentioned earlier the technology assisted verification. That's where a technician can check another technician's work for specific products. If you work in a class Q or R where you're there by yourself with no pharmacist, that requires an annual competency, initial and annual. If you're doing remote data entry, so you're doing it outside of a pharmacy at your home, possibly, that would require it. If you're doing any kind of remote supervision, that would require it. You're doing work that is being supervised remotely. And then if you're doing any remote non-dispensing activities, it requires the competency assessments. So what we find on inspection is these weren't done, or the paperwork, no one can find them, especially in electronic systems. We're having trouble people finding these things. They did them, but no one knows how to bring them up when we want to see them. Other inspection issues that these, not always, but a lot of times technicians are involved in these. Technicians are usually responsible for checking for outdated drugs. There's times where, especially where certain bays are dedicated to, assigned to certain technicians. Some of them, you don't find anything. Another one, you find all kinds of outdates in. So that technician probably wasn't doing a good job on that. Overfilled stock bottles, that's when you pour tablets and capsules into a stock container, and then there's more than originally came in there. So you're filling a prescription, and you took 2 stock bottles, you end up throwing one of them away and then realize, oh, I don't need this many, and you pour them all back into one bottle, and it exceeds what the original 100 or 30, what was ever in there. Repackage, return to stock labeling. Technicians a lot of times are doing the repackaging. Are they putting the correct expiration date and lot numbers on those? Return to stocks. Well, let me go back to repackaging. It's the expiration date becomes the lesser of 1 year from the date it's repackaged, or the manufacturers if that's less. For return to stocks, usually technicians are involved in that process. Return to stocks need 3 things left on them. It needs the prescription number, the date of dispensing, and the name of the drug and strength. We see people take their black marker, they want to take the patient's name off, but then they're also taking off the fill date or the RX number and that. So again, technicians are in that. We do prohibit drug product being stored directly on the floor. A lot of times technicians, there's no room on the shelf. You got to put it somewhere, so they just set it on the floor. Dispensing errors, technicians could be the one doing the data entry that, if it was a data entry error. It could be if they're doing the actual preparing of it, the counting and pouring and labeling. Technicians are involved in that activity, and errors are occur at those processes. For compounds, again, a lot of times it's the technicians doing the compounding. They're also filling out the compound log. They do those things incorrectly. The pharmacist reviews them and doesn't catch them, especially if you're using forms that come pre-populated with the lot and expiration date of the ingredients that was used before. People don't check those, and then it has inaccurate information when you change and using a different lot for an ingredient. And then because technicians do a lot of compounding, we do test products. We collect samples on inspection. Some of them fail due potency, And usually when the response back, we hear things like the mixing process wasn't good, stuff like that. And technicians are usually the ones doing that. So you play a role in compounding where things can sometimes go wrong. For sterile compounding, for those that do that, these are just some of the common things we see that technicians are involved with. Skills assessment, that's kind of like the competency assessment, but a little specific for sterile. Media fills, both of those being past due. When we're actually in pharmacy watching staff, we see improper hand washing, garbing, aseptic techniques such as blocking first air. We watch and see that they're not disinfecting the gloves during the process. They come out of the hood, touch stuff, and then don't disinfect their gloves. Technicians are usually ones doing the cleaning of the hood and the room. We see improper technique. Because they're the ones doing all these activities, the records documenting those activities, we see issues where it's not documented at all or inaccurate records. And then just in general, failure to follow the pharmacy's policies and procedures related to sterile compounding. Some of the investigation issues that we involving technicians, drug diversion, this could be controlled substances or non-controlled. It can just be outright taking it from the inventory. It can be also just taking filled prescriptions from the will call bin. It can be shorting people when you're counting. They're being shorted, intentionally being shorted are some of the examples. Other thing it can involve is just fraudulent or unauthorized prescriptions, making up prescriptions for friends or yourself or family that were never authorized. They get filled and then sold. Adding refills onto prescriptions that didn't have any are all examples of how drug diversion can occur. We also have just theft of cash, merchandise, food and drinks, a big one. Gift cards, coupons, reward programs, all of those we've seen over the years. Employee discounts, giving it to people who shouldn't apply to. We've seen issues of theft involving credit and return processing, and then undercharging customers for things. So those are all examples of non-drug theft that we investigate. We learn about these there's mandatory reporting. If a pharmacy terminates a technician, they have to report. If it's for a cause that we could take action on, they have to report that to us. So that's how we find out about these. In dispensing errors, I talked earlier, when we do a dispensing error, we're always seeing who was involved in that process. A lot of data entries and actual, counting and pouring and labeling are done by technicians, and they've had a role in that error. We see HIPAA violations, patient confidentiality. This can be, I'm going to say unintentional, where you actually sell at the counter, you sell a package to the wrong patient that now you gave someone else's information to the wrong person. We also find intentional violations where an employee is intentionally going into a record to get information about a patient and then using that to contact the patient, things like that, or discussing a patient's medical history outside of the pharmacy with other people. We've had cases involving all those before. We've had cases where technicians have failed drug screens or refused drug screens by their employer. And then just criminal activity. If it gets reported to us that you've had a conviction, depending on what that conviction is, we may have to investigate that matter. So after investigation, the board can take action on a license if they deem it necessary. There's kind of two kinds of, there are actually three. They can do no further action and don't do anything. They can do a non-public, that would just be a letter to the individual. You can continue to work in the pharmacy. Sometimes the letter asks for corrective action. And then you can also, it just advises you that future reoccurrence may lead to further board action. And then a public discipline, there's two types of those. First is employment disqualification list. That prohibits you from working into a pharmacy for a set amount of time. That can be up to 5 years, that you just cannot be employed in a pharmacy at all. The second is a conditional registration that is similar to probation for pharmacists and interns. That, you know, you can work in a pharmacy, but you may have specific terms applied to you on what you can and can't do. One example, if it's related to substance abuse or maybe a drug conviction, one of those terms may be random drug testing. Again, this is for a set time period. The maximum would be up to 5 years. This is just a summary in the last fiscal year, how many actions the board, public actions the board took. There was 26 employment disqualifications. You see the greatest number there was diversion of drugs, and then followed by criminal history, and then illegal use of drugs or positive drugs test. And then you see drop down to conditional registration, not as many there, you know, theft being the most common there. So now I'm just going to tell you some of the resources we have out there for specific for technicians. We have some guides out there. We have a technician guide. I believe we may be working on a revision to this. So hopefully we'll have a new one. This one's from 2021, but it's a guide specifically written for technicians. We also have a regulatory quiz on our website that a technician can quiz themselves to see how well they know the law. And then not specific to technicians, we have the pharmacy practice guide that covers everything. Again, these guides are written in layman's terms, trying to make it easier for people to understand regulations and the statute. So those are all out there on the board's website. If you click the link on the homepage, news and board publications, it'll take you to those. If you need to get a hold of someone at the board, you can contact the board office via email. Our standard email for the board office is MissouriBOP@pr.mo.gov. As I mentioned earlier, if you want to get a hold of an inspector directly on the board's website, if you click the link to the right that says board inspectors, you'll get a table showing what counties, and then in St. Louis, it's divided by zip code that inspectors cover. It has their phone number and email address on that table. And then if you go on our website, you can submit a question electronically there. We have two. We have Ask the Office. If you have questions about applications, stuff like that, it would be best to do that one. If you have a specific compliance question, you can send it directly to Ask an Inspector, and one of the inspectors, may not be the inspector in your area, but one of the inspectors will get back with you and answer your question for you. If you'd like, you can sign up for the board's alerts and newsletters on the board's website. On the homepage on the left side is a Get Pharmacy Board News. It'll take you to another website where you can do it, but you get the option of, you can get these by email or text, or you can do both. You can sign up twice, one for email and one for text, and you can get them that way. But we send those out. We average probably one a week of different things out there that we just want to get out to everybody. And then the newsletter comes out about every 3 to 4 months approximately, and we have those, and that's how we announce them that they're out there. Okay, so that's the slides I prepared today. We're now going to switch over to answering some of the questions we got. So give me just a minute while we switch things up here. Okay, and Natalie's going to read me the question, and then I will try to answer it for you.
Can a technician enter the DUR codes prior to pharmacist final check? The pharmacist would check the DUR codes at the final verification.
As long as the pharmacist is checking those, I would say yes, but you might be violating your pharmacy's policy and procedure doing that. So I would double check. A pharmacist can always tell you what to enter, that's fine, but the pharmacist is required to always check, those DURs. And I will tell you, on air investigations, we do look to see Was there a DUR that would have prevented that error, such as a high dose, or a duplication of therapy like that? We do go to that and see, did, a pharmacist, override that? And sometimes it's not the their initials may be there, but it's not them who had actually overridden that.
If a technician is allowed to read what's on a patient label, does this also include auxiliary labels? For example, if a patient asks if a medication needs to be taken with food and one of the auxiliary labels reads take with food, can the technician read that?
Yes, as long as it's in writing and applied to the label, that would be. But again, your pharmacy, the pharmacist has to authorize you doing that, and the pharmacy must have a policy and procedures spelling out what you can and can't do.
If a product is reconstituted using a FillMaster machine, does it still need to be checked by a pharmacist before it's dispensed?
It does. A pharmacist always has to check it once a technician has manipulated the product. So even though the FillMaster, is doing the measuring and stuff, it's still, the pharmacist has to check that, take a look at it one last time.
There's a question about repackaging return to stock bottles. The question mentions that when you were speaking in the presentation, you stated lot numbers needed to be on these products, but the slide only reads that the expiration date needs to be on them. Is this required at this point or just a future expectation of track and trace?
Yeah, the slide may not have been the best wording there. That's two different things I was talking about. One is repackaging, and then the next separate issue was return to stock. So those are two different things. Repackaging is when you're taking something out of the stock bottle and putting it in another, container. That requires a lot and expiration date when you do that. Return to stocks do not have any, are not required to have a lot number. It's actually the prescription label that is on that return to stock is the label, and all you're required to keep on that is the prescription number, date of dispensing, and then the name of the drug and strength. The expiration date defaults to 1 year from the date of dispensing, so it's not required to have it on there unless you know it would be less than that. If you knew it came out of a package, you would need to write it on there if you knew what it was.
Can a technician wear their Missouri technician registration card on their badge instead of wearing a badge that states pharmacy technician?
So I believe they're talking about the wallet card, the little wallet card that comes with it. I don't know. I don't have a wallet card with me, but if it says technician on that card in their name, then yeah, that would suffice. It doesn't have to be, it can be a handwritten badge. I've seen people temporarily do that for like new employees that they don't have a permanent badge made up and stuff. So but yeah, I guess you got your wallet card with you, Natalie? I don't have one with me.
Always, Tom. It's always with me.
So I assume it says technician on it. So yes. I got a notice from the office that the 2025 technician guide has been posted on the website. So my slide is out of date there. We do have a new one posted so we do have an updated version. So make sure you check that out.
Will it be stated in writing that approved license photos can either be a 2x2 photo attached to the license or a non 2x2 photo that is approved and printed directly onto the license?
I'm not aware it's in writing anywhere. We haven't added that to the practice guide yet. We will in a future one. If you want it in writing, send me an email and I will put it in writing for you.
Do you need to block out patient names on return to stock bottles?
The board does not require that. I know some pharmacies require it. They just prefer not that to be, in case it gets somehow mistakenly sent out. Also, if you send it back for destruction in that bottle, it would be an issue. But the board does not, it's not one of the things that was required to be on there, but I do know some pharmacies have policies that you do that.
Is failure to pay income tax still an issue?
Okay, so for those, that is the House Bill 600. If you remember, for years, we were always publishing lists of people that revenue has told us we need to suspend their license due to tax purposes. I don't know the official status of that. We haven't seen a new list in a long time, so I don't know the answer. If it does, we would be emailing it out like we used to in the past if that starts back up again. I don't know the official status on if they're not doing it at all anymore or what's going on there.
Does first and last name or just initials and then word technician, what's required to be on the name badge?
It needs to be their first and last name. Now, if they have if they go by a different name, so like, you can, if they go by, standard to go by their middle name, you could have that, if that's the name they go by, but it needs to be a full first name, a name and the last name, and then the technician on that. Looks like someone says they're having trouble finding the new guide on the website. I will have to go look. I don't have access to it right now. So we'll be sending out an email alert with a link to it probably when it is later once it's there. So I'll have to look into that. I'm not aware. I don't have access to it right now. Okay, well, we are almost out of time. So the next webinar is going to be Thursday, September 11th. It'll be our annual compliance update with an extended question and answer session. Natalie's coming back for that, so we'll have Natalie back next time. We usually have an extended period where we have a discussion with some inspectors on what they're seeing. So that'll be the next one. I think we'll be announcing that later this week, so watch for the email alerts on that and you can register for that. We do record our webinars. It takes approximately 15 days, sometimes longer, to get them posted. We do previous ones from this year. We did one on the MoPro system and an update on the new regulations that went into effect earlier this year. And then we did, MoHealthNet came and gave us a pharmacy program update earlier this year. For continuing education, you must complete the post survey to earn CE. So if you're on the browser, do not close your browser. Once I say I'm closing it, the webinar, a little window will pop up. You hit close there. Again, do not close your browser, and the survey then will open. Answers the questions and click submit. If you're on a mobile device, it will automatically pop up, is my understanding, when it ends. If you do not get the questions, you can email us at compliance@pr.mo.gov and we will send you the questions, but you must get the answers back to us within 24 hours in order to receive CE. We will email certificates. We no longer mail them in approximately 30 days. And again, save your certificates because we do not report to the CPE monitor. So I want to thank Natalie for coming today and joining me on the webinar today. And thank you all for attending the webinar. You all have a good rest of the day. I am going to now close the webinar.